Hi, everyone. Nice to see you. I'm Meighen Speiser. I'm the Executive Director of ecoAmerica. And for the sake of our friends online that are sight impaired, I will describe myself as a middle-aged white woman with dark hair and wearing a blue dress. So thank you for joining us. We're going to go on to our next session now, which is Core Climate Initiatives in Healthcare. And we're going to try to catch up on some time. But just to begin, today you're going to hear a lot about engaging others on climate change. That's what we're trying to do, is to create a social movement around climate change, and particularly with you around health. Because Americans are not hearing enough about climate change. If they are, it's the bad news. They're certainly not hearing about solutions enough. They rarely hear about the health benefits, but many of you are doing some good work in this space, and we can't stress enough that your role in this space is critical. We literally can't do it without you. And part of what is possible as well is inviting others into action. So that can be anything from inviting them to spread the news on climate, to inviting them into taking direct action on solutions. And so in this session, that's what we're going to be talking about. We're going to be talking about inviting folks in, and what are the actual actions that people can take to be part of the solution on climate change. So join me in welcoming our three speakers. I'm getting to that. Dr. Antonia Herzog of Healthcare Without Harm, please join us. And all of their bios are in your participant packet. Dr. Lisa Patel of Medical Consortium on Climate and Health, come on up. And Dr. Tummala from the George Washington School of Medicine and Health Sciences, come on up. So welcome, welcome. Come on up. I'll sit here, yeah. Great. So I kind of rushed through all of my talking points here. We're gonna have 5 questions, and hopefully have time for questions from you all and folks online. So why don't we get started? Welcome, everyone. The first question is, it's a multi-question, so try to remember. It's not a test, but I think you'll be more than qualified to talk about this. So what is your initiative and the goal of it? What are you doing? What are your tactics? And what level of work do you do? Local, state, or national? So why don't we start with you, Antonia?
Sure. Is this on?
Yeah.
Okay. Thank you so much, and really excited to be here on this panel and discussing this important issue around healthcare. Too often, we haven't focused on healthcare. I mean, Healthcare Without Harm certainly has. So Healthcare Without Harm, in case you're unaware of our organization, let me just give you a little background on what we do, and then, of course, answer Meighen's questions in the process. So Healthcare Without Harm, we've been around since '96, and our focus is on healthcare sustainability. So it started way back when in getting mercury thermometers out of hospitals, and that was a successful campaign. And it's grown since then. We work on chemicals, procurement, food, and then, of course, I work on climate change and health. And that, like all of us, that area has grown within Healthcare Without Harm. So our focus is on healthcare, the healthcare sector. And more specifically, we work with large healthcare systems around the country. And we work with them to decarbonize their facilities and operations and build more resilient communities, the communities that they serve, their patients. And in addition to that sort of more on the ground work, the solutions work, we also promote solutions at the federal, state, and local levels. I work on federal policy and advocacy, so I promote federal solutions that will help healthcare systems to decarbonize, and to become more resilient. There's a lot that can be done. I'm not sure if folks are aware, but the mission of healthcare is healing. and yet they are not an insignificant part of the problem. In particular, the healthcare sector as a whole is about 8.5% of US greenhouse gas emissions. And they're a significant, as we all know, part of the economy, about 20% of the US economy. So they both have a part to play, and they also have a very powerful voice. So in particular, we have a group of leaders, and it's called the Healthcare Climate Council. And this consists of 21 large health systems from around the country. They're in 43 states. They have 1.3 million employees and serve 81 million patients annually. So that's a significant reach. Now, these are, I'm not going to pretend otherwise, these are big businesses. They have a lot of priorities, even though, frankly, more than a majority of them are nonprofits. You know, finance is always a consideration. So, you know, how do we get them to create the change we need? And I'll say that our leaders have all taken on climate or clean energy commitments. Most of them have signed what is, I don't know if people are aware of it, but the HH Climate Health Sector Pledge, which aligns with the Biden administration's approach to 50% by 2030 and net zero by 2050. So we work with these leaders to both show what can be done, as well as just, you know, the solutions and the resilience angle, as well as using their voice here in DC and around the country to promote those changes and policies that will support them in making the changes. I'll stop there.
Great, thank you. Speaking of using your voice, Lisa, why don't you talk about the work you're doing with Medical Consortium?
Sure. Yeah. So I'm the executive director for the Medical Society Consortium on Climate and Health. That started about 7 years ago. Thanks to Dr. Mona Sarfati was the original founder. And the purpose of the consortium is really for the House of Medicine to speak as one on climate change as a health threat. We are now up to 50 medical societies. We also have 25 state clinician groups within our network. Some like Dr. Samadout's VCCA, which was started by their hard work on their own. Some other groups where we've sort of helped facilitate those groups within certain states. So our network is quite large. And our mission really is to communicate the health harms of climate change and to identify really fossil fuels as the driving force for that. And so to transition us off fossil fuels towards renewable energy quickly. Our work in the healthcare sector has really been more recent, and that's come about really from our state clinician network. So I actually got my start doing local and state level advocacy in California. And what I learned very quickly from connecting with various faculty and staff there was how much climate change felt like a big problem and too overwhelming of a problem. And so in terms of engaging health professionals, doing something at your site, at your clinic or your hospital was a very easy, tangible way for people to engage in this larger issue. And so we actually had a group of us between Stanford, UCSF, and UC Davis started putting on a yearly symposium where we engaged with our healthcare CEOs on, and fortunately our CEOs are very thoughtful, kind of like to have their feet put to the fire, and they join us in a yearly conversation on what they can do for climate change. And it's just brought more and more health professionals into the fold and wanting to be engaged on this. And so sort of drawing from that experience and then hearing from our state network who are really trying to move state and local policy, but usually a lot of our state clinician groups are a small group of really dedicated, and to the point of this day today, it's really how do we build a bigger movement? What we heard from them was a similar sentiment that the way to get folks in and to understand these larger structural issues, the easy way to bring them in was to talk about sustainable healthcare. Now that's not our charge, that is really more the work of Healthcare Without Harm. So we've actually in the process of forming a memorandum of understanding to work together with Healthcare Without Harm, because they really bring the the expertise and the mission, and we have a really amazing advocate network that we think we can really do some great work together. So this work just started a few months ago. We have about 15 state clinician groups represented in this working group on healthcare decarbonization, and then we have a smaller leadership group that is coming up with a strategy and a plan on our ultimate goal is that healthcare sustainability is not extra credit, as I think has been said in a few essays, but it is mission central. And so coming up with our strategy on new rules, regulations, or policy to really make it something that healthcare systems have to do rather than choosing to do.
Fantastic. Neelu.
Sure. Thank you for having me. So the way that I think about sustainability and climate change from a clinician standpoint is what can I do as an individual? And I think that there are three main areas that all of us agree are areas of focus, and that would be research, advocacy, and education. And so we're lucky enough here at GW where we founded the Climate Health Institute, and I'm one of the co-directors of that. And I think Katie was here. She's also a member. Oh, she's right there. Perfect, thanks. And so with the Climate Health Institute, we really, I've been able to really think about the education component of that. And so this was really led by some of the medical students at GW who really wanted to incorporate climate change into the medical school curriculum. This was not a quick process, nor has it been an easy process. And they really did a lot of the lifting, and I was lucky enough to be one of their advisors. But this past fall, we finally got approved to have climate change be longitudinally integrated into the medical school curriculum. And so this is going to be an eventual rollout, where each semester we start to build upon the work that's done the prior months. But that has been a huge win. And, really, again, it's incorporating our medical students into the work that we're doing. And then also what Antonia was talking about in terms of healthcare sustainability, this has been an even slower process in terms of getting the hospital to form a sustainability committee. But that also this past year, we were finally able to do. And so we've been meeting monthly to try to figure out what are some of our initiatives that we can do to make GW Hospital more green. But a lot of these initiatives require someone on the ground to be the push person, to be meeting with the hospital CMO, to be pushing for these conversations, to be talking to the medical school curriculum directors. And so that is what we as individuals can do. And we use a lot of the guidance and leadership that these health institutions offer us. But again, you need someone who knows an institution well to be able to do that. And then just from the advocacy component, I am on the steering committee of Virginia Clinicians for Climate Action, which is what Lisa referred to, and our founder, Sam, is here as well. And that has really allowed me as an individual to grow in terms of being a personal advocate. So I have an op-ed coming out that I wrote with Irene Matu, who's at UVA, on Virginia pulling out of the Regional Greenhouse Gas Initiative. So that allows us to get our voice out and say, as healthcare professionals, this is something that we do not agree with. And we go down to Richmond and we advocate with Virginia legislators there. And so again, this is us taking our individual perspective for the patients that we're taking care of and saying climate solutions or health solutions.
Wonderful. You all are working on so many amazing things. I'm thinking about the last session and really the need to build resilience while we work towards mitigation. As particularly Jackie Patterson pointed out, there are so many who are suffering from the impacts of climate change already, on top of compounding injustices. And so can you talk a bit about the work that you're doing to work in resilience into your work as you advocate for mitigation? Neelu, why don't you start?
So in terms of like personal resilience doing this work?
It's like the topic of working towards resilience for your communities, and it could be personal resilience too.
So I think one of the ways that I have found a lot of strength in terms of the work that I do and building community support is by having a community. I don't think I could have done any of this without, again, having VCCA or GW, the Medical Society Consortium, to be able to lean on. And I think when you have sort of this community mindset, that allows you to make advancements as a healthcare provider that you may not have thought were sort of within your purview. For me as a surgeon, that I had originally been thinking about. I think that when I think about the communities that we're trying to help, it's really every little bit matters. And I think that's from like a community resilience standpoint. So last night I was at a dinner, a Climate Week dinner in New York, and I saw Dr. Lazarus there, and I'm sure a lot of us use his research, Dr. Maybach's research. And he had once given me the advice to be experimental when thinking about like how we can approach the work that we're doing and how we, we are working so hard for the frontline communities that are really facing a lot of these impacts. And so I keep that advice in my mind because I think it's every little bit matters. And so it's forming that community and then trying to help the communities that we are entrusted to serve in any way possible.
Wonderful. Lisa? Sure. I'll talk a little bit about sort of systems resilience and give an example. So last year, I was working in the hospital. We had a heat dome event in California where the temperatures topped 116, 117. And over that Labor Day weekend, I worked 2 24-hour shifts. So I was there pretty much that whole weekend. And I had several newborn families that were going home over the weekend with their infants. And this is in NorCal. I don't know, 60% of households about have access to air conditioning, but then there's an additional problem of energy security where people may not turn on that air conditioning because it's too hot. And so because I work in climate, because I know the data that an infant born during a heat wave is at higher risk for mortality in that first week of life, I knew to ask this family if, and several families actually, if they had access to air conditioning, and 2 of the families did not. And so as we were thinking about, we often talk about referring our families to cooling centers, for example, but imagine having a newborn and you're going to go sit in a cooling center with your brand new infant. So we actually work with social work. We help them call a few different family members. They did end up finding a family member they could stay with during the heat wave to be safe during that period. But it really brought home this point of, when we think about where all the various places of resilience needs to be, we need to be thinking about what different resources we can offer people in terms of social work being aware, or we as clinicians being aware, when we can't necessarily create those public systems like a cooling center, for example. So that was just one piece as we're thinking about resilience and adaptation, the work that we need to do as clinicians to make sure that everybody is aware of these risks and we're counseling our patients appropriately. The consortium specifically, we're also working with the National Association of Community Health Centers, who are very interested in having more clinics take advantage of the dollars from the Inflation Reduction Act to install solar and be able to keep the lights on so that they can continue to serve as a resource to their patients and communities, even during times of climate distress. And so we're working on a toolkit that we'll be launching in November with NAC that we're excited about. It's both an advocacy toolkit and some patient-facing and clinician-facing materials on really framing these climate interventions as health interventions and how they can access those IRA dollars for improved resilience.
So important. Antonia.
Yeah, sure. Wonderful examples from Lisa and Neelu. It totally shows how the important role of physicians in healthcare systems, which I didn't get the chance to directly touch upon. But as I said, these institutions are often conservative. There's a lot of inertia, and it's the physicians, frankly, within them that have very strong and powerful voices. You can, believe it or not, create change within your institutions. And I encourage all of you here who are health professionals, if you work at these health systems, to organize and raise your voices and send letters to your CEO to create the change that you want to see, be it from greening the OR, reducing the worst anesthetic gases that are extremely potent global warming gases as one example, to the resilience side, which is what you're asking about. So having the information that they need on hand to supply their patients with, just as Lisa was describing, to be aware of what those impacts are on their patients and how to help them deal, how to help the communities that they serve deal with the climate impacts. Heat is obviously the worst in that way, but hurricanes, flooding, et cetera, also have, and wildfires are also a big problem around the country. I was just looking at HHS public health emergency announcements. They just put out one for the most recent hurricane. They've put out 5 in the last, since the beginning of 2023, related to extreme weather events. Several hurricanes around the country, wildfires, extreme winds, et cetera. So HHS is stepping up somewhat. They have a long, long way to go, and we're working with them and all the divisions and offices within to make them more aware of these types of climate impacts and the need to build resilience for the people that are impacted.
Yeah, I mean, I really love these examples of really taking the matters into your own hands in a way, of really helping to care for folks during an extreme weather event. And I think more guidance needs to be given to folks that interact with people individually on that, because that's, you've got oaths to care, right? And so really taking that to the next level in a changing climate is so important. Building on that, and you've already touched on this a little bit, but can you talk about how you've used your voice to make the climate and health connection for either the public or other health professionals beyond what you've shared? And anyone who wants to go first? Lisa, how about you go first?
I actually got into this whole work in the beginning in 2017 when we withdrew from the Paris Climate Accords. I had just become a new mother and was just a few years out of residency. And so I thought, I'm going to focus on becoming a doctor, becoming a better doctor, and I'm going to focus on being a mom. And then we withdrew, and I've been studying climate change for close to 30 years now. And in my mind, I always thought, well, no reasonable person who's seen this data is not going to take this seriously and do something, right? And when we withdrew from the Paris Climate Accords, I was like, oh no, we're willing to run ourselves off a cliff. This is insane. And so I got involved in the American Academy of Pediatrics, and I started showing up to their legislative days and learning, and it was that entry point where they really inculcate us with this sense of our voice matters, our stories matter. And so I came into this movement really just learning about advocacy skills. And then it was 2019 when the youth movement started that I was able to bring together my previous history and work in environmental science into the climate movement. But our, I think we've said that, and I think everybody in this room knows this, we're trusted. We are emotional creatures first, we are rational creatures second, third. And so our stories and talking about what we're seeing on the ground with our patients really accesses people's frame in a way that can ultimately change their minds. And so the way I've used my voice, I started by writing op-eds, meeting with my decision makers. And then as I've moved forward in the process, I just try to spend a lot of, and now especially in this role, it's really more around creating the training opportunities to teach others how to do that. And I think often people think, I think somebody said this before, or it was Ben that said that the more degrees after your name, the less you feel like you can say something about it. And so I feel like my charge is to do what the AAP did for me, is to say that I might not know something that much about a particular issue, but I know enough, and my voice is too important to sit this out. And so giving people that sense of confidence to speak up.
Absolutely, we couldn't agree more. Neelima?
So I think I also started around 2017, and for me, it was also going back to that advice of being experimental. It was like a little bit of a slow roll into figuring out how to best use my voice. And I did a one-year fellowship with the Yale program on climate change communication. And I think, as public health professionals, we don't always feel equipped to be able to communicate directly with the public on certain topics, although, I think we all have the necessary tools to do so, but I think that sometimes doing some semi-formal training like that can be helpful if anyone has concerns about how to start writing an op-ed or how to talk to media. Sometimes having that training can be, again, we feel like we sometimes need the training to do the talking or the writing. But it really was me just trying to figure out how to get other people to care about the things that I care about. And so that is really sort of the mindset that I go into anything that I write or say, is to say, okay, this is something that I'm reading about, I'm seeing the studies, I'm seeing in my clinic, I'm hearing about from colleagues that they're seeing in their patients. How do I get other people to care about this? How do I get other people to understand what's happening to them? And then therefore to be more likely to push for climate policy, to vote, things like that. I think one of the other things I've learned since I started seeing patients on my own out of residency is that, talking to patients about things like voting and legislative actions, that's a part of who I am as a physician. It's a part of me taking care of my patients versus it being something on the side or the whole out of my lane thing. And it's not, right? It's in our lane. It's a part of healthcare. And so those were sort of like the big learning curves for me.
Fantastic. Antonia.
Yeah, sure. So ours is a slightly less direct. As I said, we actually have a physician network, and the focus is more internal to their using their voice within their health system to create change and get their institutions to make the change that's necessary to address the climate crisis. But in fact, we're having our climate council that I mentioned earlier come to DC in a month to advocate for climate action to Congress and the administration. So that's, and some of them are doctors, even though they also have a sustainability hat within their institutions as well. But they bring that perspective, that health and patient focused perspective, which is essential to this conversation. So my hope is that we'll have some good conversations and we'll show both what health systems are already doing around the country, but also how much more needs to be done, and those policies that will help them get the job done, because frankly, they're struggling to do this work in a, let's say, cost-effective way, and making the case to their broader institutions to do it. I talked about the health, HHS health sector climate pledge. Only probably about 15% of hospitals around the country have signed on to this. Of course, we need to get to 100%. But again, not all hospitals and health systems are the same. There's rural, there's safety net that serve lower income, there's tribal and territorial, and they don't have the capacity, expertise, knowledge, resources to do this work. And that is what HHS, DOE, and others within the federal government, and frankly Congress, if we can get them to do something useful, which they did last year. They passed the IRA, but they need help to do this work, and that's what we're advocating for.
And I think we've heard it from all three speakers. The more we can use our voice to make the policy change, the more we'll have the opportunities at the local level, right? So the national work is very important. The local work is critical as well. And people are social beings, they're emotional beings. And so the more we really can relate to folks, I mean, our research shows that people do resonate with the climate and health connection. They just need it to be reinforced around them and to be invited into action and to be invited into caring for their health. So I want to, speaking of inviting in, last question for you before we go to Q&A, which is, how can folks here and the folks joining online participate in what you do? Antonia, why don't you go
Okay,
first?
sure, I'll start. I guess that, how the key message I often say, first of all, the healthcare sector's mission is to do no harm. And in an extreme weather event, if a facility does closes down, that has a severe impact on human health. I mean, I can't think of much more that does. They can't get the health care they need. And so, again, we are a little more internal looking because we believe that the healthcare sector and health systems in particular have an extremely powerful voice. They employ a lot of people. They are incredibly important, obviously, to protecting people's health. And so again, using your voice from our perspective internally at your health systems like Lisa and Nilu have done, and to create that change internally. If we got all of our health systems on board saying we need to take action around the country, I can tell you that will have a significant impact.
Wonderful. Lisa?
So we're really excited in 2024 to be working with a number of partners, including Healthcare Without Harm and ecoAmerica and APHA and many others, to do a coalition-based meeting, understanding that this 2024 is really important for civic participation, and to really elevate climate change as an important point of civic discourse during that year. So I encourage you to join us for our annual meeting. It will be from February 11th through 13th in person here in Virginia, or you can also join us virtually. We remain committed to having a hybrid option for those that want to minimize their carbon footprint. And then wherever you are to this point, right, if you are, you can try to find other people. I guarantee you, if you reach out to people within your hospital system or clinic system, you will find others that are concerned about this issue, want to do something. So whether that's the action you take, whether you join a state clinician group through the Medical Society Consortium on Climate and Health, whether you're in a state with Physicians for Social Responsibility, which also has some chapters where you can get involved. The organizations are there. It's just a question of reaching out to find the right place for you.
Wonderful. Nilu?
Great question. So I think there's a lot of different ways that we can each take action. I guess I'll share with you what I'm planning on doing, and then you can choose to sort of build from there. But I think the big thing is just looking at your own community. And so for me as an ENT, one of the things that I'm doing next month is I'm talking at our National ENT Academy meeting about climate change and sustainability in healthcare. So that's looking into my community of fellow ENTs. Obviously, November is coming up, and so voting is, on top of mind, especially Virginia. This is a really important election. And so in 2 weeks, if anyone wants to join Virginia Clinicians for Climate Action, we're partnering with the Environmental Voter Project to try to mobilize voters in Virginia. And then the third thing is really, I think we do this all the time for anyone who's in this room, is, again, talking about it as much as you can with your parents, your family, your friends, your coworkers, anyone who you think, is not as educated about this as they could be, and you can be that sort of voice inside their head that's saying, okay, this is something that this person I care about cares about, so I should care about it as well.
Thank you. And I will add, Ben showed earlier that Climate for Health offers an ambassador training. So no matter if you work in a clinic or you're a public health professional or public health educator, you can take that training, receive 3 CE credits, and really build that confidence in engaging others. And we'll talk a little bit more about our Climate RX program as well as another way to engage. All right, Q&A. We got maybe time for one question here. So I'm going to start with your folks online. Hi, online. Raquel is asking, is there a compilation of examples such as those mentioned by the panelists, newborn and heat, solar as health solution, to share with physicians and other healthcare workers who work with low wealth families? Lisa, you want to jump in on that?
So I haven't looked through the full case compendium, but the Center for Innovation for Global Health at Stanford, and I think it was University of Washington, worked together on clinical cases that they've just put out that is really more of a global context, and so does get to families that will be in lower resource settings. And I looked through the heat case, and it is exquisitely done. So it may not have, my example of a newborn, for example, they take a range of different health issues, a range of different ages. And I would say that's a fantastic resource to point people to, especially as we're thinking about medical education, because it has, the presentation, the differential, what you can do in terms of individual counseling, and then what you can do on a policy or systems level.
Anyone else have anything to share with that? All right. Any questions from the room? If not, I'm going to go to another online question. Deepa is asking, what, if any, efforts are you aware of to combat disinformation targeted at healthcare professionals? So she's saying that unfortunately, even most educated and well-intentioned among us can fall prey to disinformation. Any thoughts on that, Nilu?
Sure. I mean, I think that we can all agree that the online marketplace can be a brutal place. This is, I think since I started talking out about climate change is the first time I ever got hate mail. And so it's it's been a new experience. But really, I think it's, there's always going to be things, there's always going to be disinformation campaigns. And so the way that I approach it is mostly, ignoring the things that I don't agree with, or, correcting it in the way that I think is going to be palatable to the people that I care about and who I think are the vital listeners in the room. There's always going to be people whose minds you can't change. And then I would say for me personally, they're not the people that I focus on. And so it's really just who are the people that you're interested in educating, and then just doing the best you can to continue to push forward what you know to be true.
I'd love to build on something you just said, which is that you got hate mail, but you've been on national television talking about this, right? But I think that's one of the reasons people are afraid to step out and talk about this issue, that there's a fear there. So could you talk about ways that you deal with that? What do you personally do to get past that fear or to confront it? Neelima, why don't you start, since you have that example?
Sure. I think the biggest thing is that you surround yourselves with people who are doing positive work and that you can find strength in. Like this past Sunday for the Climate March in New York, Sam and I were both there, and we were joined by, there was a lot of other healthcare professionals there. And so being a part of that energy and being a part of a group of people who have dedicated their lives to health and who cared this much about climate change was really invigorating. And so I think it's that you surround yourself with a lot more positive energy than negative energy, and then that gives you the motivation to ignore those who would say otherwise.
Yeah, actually, turning this back to ecoAmerica's work, and Ed Maybach in particular, who I know you're closely connected with. We've worked with him, some of our health systems, in Nova in particular, has worked with GMU, and you've done polling, et cetera, around this issue. And one of the things, if I'm remembering correctly, is that they found that when you poll internal to a health system, surprisingly high percentage of people, be it both the staff, the clinicians, the nurses, et cetera, are actually concerned and supportive, much higher than is expected, even in conservative states. And so perhaps there's always going to be the haters, and they're the loudest and the scariest, frankly. But there's a lot more people who are just sort of sitting more on the sidelines, who really, really do care. We just have to reach out to them and find them.
Yeah, our research shows that over 70% of Americans are concerned about climate change, including almost half that are very concerned, but they only think about 14% of the people around them are very concerned about climate change. And so it makes them feel like the odd person out, and they're not odd at all. I mean, not that we know of anyway, but they're not. The majorities are concerned. The majorities want action, and we have to remember that. And when people are invited in, they're relieved. Most times they're relieved to hear you talking about climate change, because they found a like-minded person and they've got that permission to engage, and that's what's really important. Lisa, do you have anything to add?
I'll say, what we often deal with in pediatrics are people that have heard misinformation about vaccines. And so it's not unusual. The number of vitamin K declination forms that I have to go in to talk to families about. And so I think, and Neil, I think you made this point, right? I just don't, there are people whose minds I'm not going to change. And I've stopped believing that that's my charge, is if they inhabit a universe of devoid of facts and information, I will do my job in trying to speak my truth, but I'm not going to waste my energy or my time trying to change a mind of somebody who lives in an alternate universe of how they collect their information. And so we really try to engage that middle ground of folks who are sitting on the sidelines, rather than trying to convince the 10% that are the denialists.
Wonderful. Do we have time for one more question? One more. Oh, from here. All right, Karen.
Yeah, I wanted to combine some of the discussion we've had about the disinformation with one specific issue, which is more and more we're seeing, unfortunately, local ordinances being adopted that limit the ability to cite the renewable energy that is so urgently needed. And I'm wondering to what extent, if any, whether your organizations are helping physicians be ready to engage when such things come up, or even better, take preventive measures to help counter some of that disinformation even before it gets out there.
Yeah,
in local
the
communities.
preemptions,
Yeah.
right? Yeah. Lisa, jump on it.
We are just in the midst of planning something exactly around that. What we're beginning to recognize, especially in rural areas, which will be really key to a clean economy transition, is that these ordinances are coming up. And so we are in the process of doing some kind of more intellectual work to figure out where these places are, where our opportunities are in terms of where we have a state network. And so we're considering doing something through the policy lab at Stanford Law School that's interested in working with us on this. More to come, but we definitely recognize this as a big need, and we're hoping to attach some resources to it.
Thank you. All right. Well, thank you everyone for joining this panel. I think we've heard a lot of things that we can learn from, walking the walk, inviting others in, talking about this, advocating within our healthcare systems, using our voice with policymakers, and certainly making sure that we work on resilience as we work towards mitigation as well. So I want to thank everyone, and thank you, and turn it back over to Ben. Thanks.